Yeah.
Well, and speaking of injections, because that was another big, the back of my mind, it really was, as I delayed and delayed, this fear of doing it on my own, because again, the folks that I knew, the patients that I knew had done it, had lived with a partner, and they had someone. And ultimately, I don't know, I just felt really empowered. Like once I got it done, it was like boom, 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 like just knowing the process and that it's not as complicated as you think. But again, we have this mindset of like, oh, this is going to mean like, and different patients have different reactions to needles, but it's now so streamlined.
Yeah. So I think the trick is when you're first doing the injections, again, if it can be done, the teaching can be done in person,
Yes.
close to the date that you're doing it, or even for your first injection, right? It takes away that fear. And I find a lot of patients, after they're taught and it's fresh in their mind, I tell them, okay, you know how to do it, just put on the video while you're doing it so you don't feel alone.
Right.
If you're alone.
Oh, that's a really good advice.
Right? So then, I mean, you know, you put on YouTube, you just keep playing it over and over again. And then once you get through it once or twice, it becomes something that you just do for the next few days.
Yeah. And you don't even, you want to get the right amount. And I think that's part of like getting it right? Because it's a recipe almost that you just have to get the measurements correct. And to know that I had this instance where, because I had been on birth control and I was well into my injection cycle, but Ganirelix, I think I remember the name, like I had to include that as one of my injections 3 or 4 days in.
Yeah, so that prevents ovulation, right? So, and people use it, you know, there's also Cetrotide, and then now I think there's a generic version of Ganirelix. That one, you know, you want to make sure you get the whole dose because that's going to keep you from releasing the eggs, which would ruin the whole cycle, obviously.
But that was one part of the process that even like, all right, I got my injections down. Like, I know this. There's some factors that come in as you're being monitored and checked. And even up until that trigger shot, that, you know, it's changing. But luckily and hopefully with that information, you just know like what path you're on.
Yeah.
Getting you ready for that retrieval moment.
That's right. And again, you know, when you're monitoring, every clinic's different. I like to tell my patients, please come to my office and see me for monitoring because it's a great opportunity to ask questions.
Yeah.
Right? If you're seeing your doctor and they're monitoring you, how's it going? Do you see this going, you know, through the whole way? When do you think my retrieval will be? I mean, these are questions that people care about. You have a life and you need to know, I'm going to be under anesthesia this day. I need someone to pick me up. And when can I go back to work? And how am I going to feel? Is there anything I can do to decrease any risks of complications, right? These are things that are evolving as you're going through the process. If we see that you're making, you know, 20, 30 follicles, you know, we have to start worrying about hyperstimulation, right? And there's ways to manage that to decrease the risk. If you're just blindly going through it and no one's kind of guiding you, that could be a little bit, you know, uncomfortable and a little risky, frankly.